CTAC Talks, an innovative video series addressing treatment access issues and solutions for Canadians living with HIV and hepatitis C.
So I was recently in Victoria, BC because our partner Katie hosted a learning institute at the second Canadian Symposium on the Hepatitis C virus. And just before the symposium, we held a two-day meeting of the Coalition of Organizations Responding to Hepatitis B and C, of which CTAC is a member. And over that meeting, we had a great planning session and set a work plan for the coming year, as well as change the name of the coalition to Hepatitis Action Canada. So you can look forward to some really interesting work coming from that group this year. So probably the highlight of the symposium was this debate that happened right at the middle between Bryce Smith from the Centre for the Disease Control in the United States and Greg DeRay from the University of New South Wales, who both took a pro and a con approach to population-level testing. In the middle of 2012, the CDC proposed and issued a recommendation that all people born between 1946 and 1965, so baby boomers, get tested for hepatitis C. So one of the questions was, is this going to be a good fit for Canada? And there were a couple of pieces of information that maybe questioned whether a population-level testing approach will be effective here. The first one is that there was some evidence that was shared questioning whether we have the same sort of hidden amounts of hepatitis C amongst Canadians. There was also a question on whether our medical system is actually prepared to do a population-level testing spree, considering that diagnostic facilities are actually already kind of tapped out in terms of their ability to provide more testing. But I think the really interesting piece that came was actually a question from the floor, which showed that more than 80% of family physicians, when asked, indicated that they didn't ask all of their patients whether they had an injection drug history in all cases all the time. Ask some, but not all people. And so I think maybe the first thing that we need to think about is doing a little bit of education generally about hepatitis C, as well as doing some education with family doctors around doing adequate risk assessment for all of their patients so that we can potentially uncover hidden hepatitis C cases. So at this symposium, we learned that it looks like that by 2017 to 2019, we're going to be looking at hepatitis C treatments that don't require pegylated interferon. And so a lot of us know that hepatitis C treatments, even with the new drugs that are available, require taking both the original standard of care treatments, which were ribavirin and pegylated interferon. And pegylated interferon, as many people know, have really strong side effects. And it can kind of be like a year of being on chemotherapy. And so what we know is that there's some new medications coming down the pipeline, protease inhibitors and nucleosides, that are going to do a couple of things. It's going to replace the need for interferon and so reduce those massive side effects. And it's also, in really good news, potentially going to shorten the course of hepatitis C treatment from a year to 3 months. And so those are things to really look forward to over the next coming years. So before this symposium, I didn't actually know very much about hepatitis C vaccines at all, or that they were even in development. And in fact, we learned about 2 vaccines that are currently under development. One is called the Okairos vaccine. There's another one that's being developed by Michael Houghton at the University of Alberta that should be going into trials next year. It's not showing 100% effectiveness. It's actually, the hepatitis C vaccine is theorized that it's going to show at about 70% effectiveness. So it's going to be like one prevention method amongst many.
Thanks, Paul. So here's a few takeaways. Population-specific hepatitis C screening is a good strategy for Canada in terms of detecting Canada's undiagnosed hepatitis C population. And if all goes well, you should expect to see an interferon-free hepatitis C treatment and an early prevention vaccine in about 4 years. And finally, look in the coming months for a CTAC statement on the future of hepatitis C treatment for HIV co-infected people at ctac.ca. Hey, so that's CTAC Talks. Let's continue the conversation on the CTAC blog and join us in addressing treatment access issues for Canadians living with HIV and hepatitis C. See you next time.